What a privilege to be part of this conversation. I just want to first echo everything that my colleagues have said, and just, you know, this is something that our group at CHAP is just supremely excited to be a part of. You know, we got involved. CHAP has supported CHW Ventures over the last 7 years, focusing on investments that strengthen systems change, from Financing Alliance to Chic to AMP Health, and even more recently, the Community Health Roadmap. When COVID-19 hit, I think, you know, like Tom, we talked a lot to our partners and a lot to Chic and its members, and really found that PPE for CHWs was crucial. There was no question about it. We very quickly realized that no one at the time had actually scoped what PPE and how much of it was required. You know, really never before was there an advocacy play for PPE for CHWs at this time. And we know that we cannot really advocate for solutions when we haven't quantified the problem, or at least attempted to. So that was the first step. That was our first entrance into this work. We supported our staff in working together with Chic to do this. And we understood, so that we understood what was needed as a baseline. And we've been really thrilled to see the analysis leveraged for this fund. It's really been a rapid fire journey of evidence to action. I think that this is a really compelling investment, to be totally honest. And first, I want to say that operating with such speed was possible because of the flexible funding and resources enabled by these philanthropic efforts. I also really want to take a minute just to highlight what it is we know and what that means and lends itself to the impact of this investment. We know that CHWs are always the last in line for support in global health. We know that CHWs are relied upon for care, whether it's formalized or not. And there's no other dedicated effort that is focusing on protecting them amidst this unprecedented crisis right now. The efforts that do exist, they just take a lot of time to materialize because they're bigger and more bureaucratic. And this fund, you know, with this fund it's going, it's happening, and supplies are already on the ground and delivering huge quantities of PPE to CHWs. We run the risk of reversing so many gains in the morbidity and mortality reduction from preventable diseases serviced by CHWs. This is a really scary thought. This is the moment to invest in catalytic efforts that can make a difference right now, because this is an emergency. It's still an emergency, and it's going to be an emergency for a while. We also want to ensure that the impact from this sustains. We believe that this radical collaboration is doing both extremely well. The other thing that I really just want to emphasize is that I can personally vouch for this team. Each member is contributing a unique advantage. They're operating with integrity and skill. And this is really why I believe that this investment will not only have immediate impact, but catalyze real and lasting change. The community health advocates operating this work are working to ensure that all countries in scope are prioritizing CHWs in their supply and resource mobilization plans. This is not an easy task, but it is one that this group and this team and this consortium that we're all really committed to. And I think that that means that it's going to have an impact, and it already has. And